Okay. Introductions, Gary Merchant, Chair of the board and also State Representative.
Bill Marsh, I'm an alternate and a state representative.
Tom Sherman, State Senate.
Todd Fahey, the governor's appointee to the board.
Thank you. And
Nancy Ford, support.
all right, thank you.
Do you want
Regards to the,
Jim to introduce?
oh, Jim, thank you. Out of sight, out of mind.
Jim
Right.
Murphy, House Representative, member of the board.
Thank you. Sorry about that. Agenda review. Given the fact we're probably in a tight timeline today, I would like to move the future dates, which is at the end, forward, so we can talk about some sort of a date. So after we go through the review of the minutes of the 22nd, is have a discussion about when we can meet again to wrap things up as far as the rules are concerned. Is there anything else that you'd like to add to the or move on the agenda? Yes, then, good. All good. So if there's nothing else, then I'll move that we'll go forward with the agenda with the caveat that we're going to discuss the future meetings after we talk about the board meetings of the 22nd. I believe you all have in your packet, it was sent to you earlier, is the minutes from January 24th. Otherwise, the 22nd, 24th. Is there any discussion about this? If not, can we have a motion to approve them?
Move to approve.
Second.
Second with that. All those in favor say aye.
Aye.
All those opposed, I got to do a roll call, sorry.
Oh, right.
So roll call, aye.
Yes.
Aye.
Yes.
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 Thank you. All right, as far as the future meeting, I'm looking at the calendar. Given the fact we're going to be going through another legislative activity, I'm thinking about sometime probably in May, or you want to try to do something earlier. I think we're going to go into Psao as far as in May. If I could go into probably May, I'm looking at the calendar. The 23rd, I think it's when things will start to slow down. Is that work on people's calendar?
May
23rd. The next Monday would be the,
I think we're already
30th.
scheduled for the 23rd, aren't we?
it was going to be the
Yeah.
4th.
I have it on the 23rd
Okay,
already.
so all set. What about going after that? Into June or July? July is going to be, you want to try to do something before the summer starts as far as,
We have something set. Nope. Yeah.
yeah,
How about the 20th? Because I have L-chip in the afternoon, so I could just make that a full work day.
20th works for me.
Is that
Of
too
what month?
soon? The 20th, 10 to 12,
Of July or June.
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 Okay.
I mean, we can always cancel it with enough notice
Correct.
if you think it's not necessary.
June 20th, 10 to noon. All right. You all set? All right. Do we need to go out beyond that into probably September? We're going to get into the primary season, so we could wait until like September 19th, which would be after the primaries, but before we get into the general election.
I'm out the 19th.
What about the 20th?
Yep.
Yeah, we could move towards midweek
Midweek? You want to go
because we're
towards?
not in session.
You want to go the 20th? That work?
September
Yes.
20th.
September 20th?
Yes.
Okay, 10 to 12. All right.
One
Thank
thing, just since some of us are running for new offices,
Yeah.
this is not a, what is it called? It's not a legislative committee. So we actually, no matter what happens,
I'm actually the governor's alternate, so it wouldn't matter whether I was an office. I'd
Right.
still be able to be on the.
Still be on the board.
right, and same with me, even if I'm
Exactly.
Joe Schmo.
All right. So I'll give you an update as far as the joint fiscal committee. I did speak with the chair, Representative Umberger, and motion that we had before the committee was tabled. He was kind enough to leave it on the table until we get through the rulemaking process here. So what I'm trying to do today, if we can, is to approve this set of rules, get them to GELCAR, and also get them to the fiscal committee. So the fiscal committee would then, at that point in time, have the ability to review the rules, which is kind of one of the things that happened with the football. And I will be there on hopefully April 15th meeting to talk to the board, to the fiscal committee about the rules, why we have the rules, what we're doing with the rules, and what we're trying to do as far as the board itself explains certain things. Senator Rosenwald, does that make where you are?
Well, I think it's a great idea for you to be there in case there are questions, but the fiscal committee doesn't have the authority to review rules or do anything with them.
Correct. I think what I heard from Representative Leishman was because we had no rules, he was reluctant to approve the request without having some rules.
But what probably would be helpful for fiscal would be a projected timeline for the rulemaking process rather than the rules themselves.
Okay.
It wouldn't hurt for them to see what's already in progress.
Right.
So that we're getting it done.
And that's part of what we're talking about today, Senator Rosenwell, as to what the process would be like after today. We're hoping to get the board's approval today from the rules that have been drafted and get those off the GELCAR probably next week. Just to be kind of, Sherman?
So just listening to what Senator Rosenwald was saying, I think less is more.
Yeah.
That's what I
So,
was trying
so
to
I would not send the draft rules to
Okay.
fiscal. I would just tell them the draft rules are in front of
Right.
GELCAR.
Okay.
Give them that update because you may end up opening a can of worms, especially if GELCAR finds problems and they want to make changes.
Yeah.
Then you've got all of fiscal looking.
But
at
have them
this
in
as
your
well.
pocket.
In my pocket, big question for it. Okay.
So just, I would report the timeline that it's in process, and if you can give an estimated time when it's going to be approved by GELCAR, that would give fiscal some, just get a projected timeline that they can follow.
Thank you.
But also, if I could, in order to discuss the whole thing and fiscal, it would have to be removed from the table. And I don't know if that's what you want, or if you just want to let the members of fiscal know by email, I guess, that the rules have gone to GELCAR. Or do you want us to take it off the table so that you and Mr. Barry can sit down and say, we've sent the rules to GELCAR?
I look to you for some advice, guidance on that, whether it's better for us to wait till it gets through GELCAR before we take it off the table, or let them know that what's going through the process. We started it.
I think when you think it's ready for fiscal to vote on it, that's when you want to take it off the table.
Do you think fiscal is going to want to have the finale going through GELCAR before they will approve it? That's kind of the
Yes,
I would think.
I think so.
wait for it to wait to finalize.
I think Peter, Representative Leishman is already tentative about
Yeah.
how PDAB was formed, and I think the more you have your I's dotted and your T's crossed before you ask them to vote, the better off we're going to be.
Right, because you don't want them to vote it down.
Okay. All right. So I will hold off on that until we get through the process.
Yeah, sounds good.
All right. Want to provide an update on the Senate bill? Is that going through? I think
Yeah,
it's being-
it's going, well, I'm just going to have an editorial comment that is fine if it's in the minutes. Out of courtesy, when a Senate bill is going through, there's no way I can control this. But if anybody, especially members of the public or lobbyists or otherwise, have big concerns, I think it would be courtesy to bring that either to Senate representatives or to the chair before taking it to other people outside of this committee, because most of the time we can actually make those corrections or address them. We had an entirely new conflict of interest brought by Senator Bradley through the attorney for the Senate, and only after long discussions about the fact that there's actually criminal penalties in the new version of this, and that can't get much stronger than the conflict, and that, oh, by the way that was worded, most of us would have to quit. I'd really appreciate the courtesy of being talked to first, so we can not have that distraction in the future. But where we are now is we have a much stronger conflict of interest. I think it's going to be clearer. It has criminal penalty attached to it. We have addressed concerns that were brought regarding limits on fees. And unfortunately, I don't have a copy of it right in front of me, but hopefully everybody's seen it. If you haven't, let Jenny know in my office and she can get you a copy. But limits on fees, appeals process for fees. We fixed the quorum issue that we had and listened to Senator Gray, who wanted the appointees to follow the person appointing them, rather than having an alternate being able to be the alternate, sort of an alternate for anybody. The alternates have to be appointed by the appointer so that they reflect that appointer's position. Trying to think what else was in it, but those were the highlights. And I think there was a little bit of a administrative fix.
It was on, I think the non-lapsing account was
Non-lapsing.
And also the
right,
classified to unclassified for the executive director.
correct. So we merged the House and the Senate bills. The real, without this, we really need this to be able to move forward. I think we are moving forward. There is so much misperception about the scope and capacity of this board. We're not setting prices.
No.
We are not violating federal constitution. Hopefully everybody, and we will have a public session at the end. Hopefully everybody has felt like their concerns have been heard and met through the amendment. So we're actually doing, I think we're executing it Wednesday.
It might be a heavy lift in the House.
Hmm?
It might be a heavy lift in the House.
Understood, and I think we're all committed to doing our best to get this through.
Well, thank you, Senator Chairman. Regards to the rules, if you want to start on that at this point in time, we do have a draft. And Representative Murphy, do you have the copy of the rules?
No, I do not. Can you email them?
Please stay around.
No, this is what's better not getting organized.
I can go.
Jamie?
Yeah.
And while we're waiting for that, I also had some news to share with you folks. One of our board members, unfortunately, had to resign due to multiple conflicts and work was being a big one of them. But Stacy Harmon, who's been very instrumental in what we're doing on the board, submitted a letter of resignation to the board. So she
She was appointed by whom?
was appointed by the House.
But how?
She was the alternate.
So
We need to reach out to the House Speaker and find a replacement. And while I have everybody here, if you still have your letter of appointment, it'd be helpful. Because I'm trying to do is track down what dates people are appointed and what dates they'd be coming up for a reappointment.
It's November 2020.
Yeah.
Do we know which members are which term?
No. We're good for at least another year. Miss Allison?
Oh,
Should I have- yeah.
okay.
You have a mask on?
I don't know.
Would you mind? Thank you.
Great, thank you.
I think it's in
Would the
I have him, Mr. Chairman.
president's office have? it?
Mhm.
Would the Senate, would the president of the
Yeah,
Senate probably have
there's a reference.
somewhere? Hey, wanted to sit on
Sure. My name is Allison Zeno. I am the administrator here at the Department of Health and Human Services of the administrative unit.
Well, thank you for being part of joining us with the board.
Thank you for having
I
me.
see you did a lot of work as far as taking what's Rob and Todd had done and added some additional work to it. So,
I did some formatting. That's really all it is.
all right. So do you want to walk us through what? The only, I'll start off. One of the
Sure.
things I'll bring people's attention, this is something that when we ask for the pricing coming from the manufacturing community, in the statute, it says the smallest unit to be dispensed. Well, that was confusing because if you have a bottle of 1,000, is the one tablet? If you have a jar of a 1 pound jar of cream, is it by the gram? So, because in a pharmacy, you can break a package into smaller components. So how small do we want to get? So I changed this. I don't know if we can do this because it's not in the statute, but I want to ask you as well. Is under 101.05 pricing unit means the smallest available package that can be used to dispense the smallest amount of the drug. It just made sense, but again, what I don't know, and back to, I guess you, Allison, maybe some of the attorneys in the room, can we change that definition this way under rules, or do we have to go back to the statute?
Unfortunately, where your definitions are defined in statute, you would have to go back through legislation to do that. You can't amend definitions to differentiate from what they are in the statute.
So you don't, it says smallest available package,
That's the rule.
Mm-hmm.
oh, okay.
This, the statute
So-
says,
Actually, too, we would have to go through these definitions, and they would have to be word for word.
from the statute.
Yeah.
Okay, so that would mean also in 101.04, where it talks about excludes a packager, repackager, labeler, or relabeler. That basically excludes everybody. Because a manufacturer is, by the FDA definition, is a labeler. So the intent of it was anybody who's basically relabeling a product or repackaging a product, but doesn't control the price in the marketplace would be excluded. But the way it's written right now, that statute would probably be inclusive to be almost everyone. But
So, so I would agree that any definition that's set forth in the statute couldn't be changed by rule. But the statute itself, the enabling statute, specifically anticipates the promulgation of rules. So if there are other definitions that expand and remain true to and consistent with the statute, we would
Yep.
certainly be able to insert those definitions in, but you're saying we just couldn't take a defined term in the RSA and then try to
Exactly.
change it here.
Yep, and when you're defining in rule, as long as the term is used once within your rule, you are more than welcome to define that term.
Thank you.
so to go back to the pricing unit, that definition would have to go through a change in the statute
Should we attach that to
Yeah.
Tom's bill?
Yeah, we should.
on the floor.
Is that the only one?
It's the only one I found so far.
So I need language like yesterday.
So it's not 5 or 4.
That is,
Five.
pricing unit is 5,
So the language there, Tom, is what,
is what you want.
yes,
I'm not sure that that language actually works there, because if you have something like a crane that you could divide it up infinitely smaller quantities.
yes. So it's the smallest available package. In other words, it'd be, if it comes in a pound jar, comes in a 30-gram tube and so forth, you go buy the smallest available tube.
Right.
That the pharmacy would stock,
You wouldn't be allowed to just redistribute that,
correct,
then I understand.
And manufacturer is okay.
yes. And it was kind of their recommendation, was looking, because the smallest available package will have a distinct NDC number to it. That's what they're trying to get to, is what do you want? And I think it's more important for us to track the NDC number, because that's what the pricing in the marketplace is predicated upon, even though you can break it down further if you wanted to, but that's the smallest package available.
What, NEC number?
National Drug Code. That's what the FDA uses to identify the product in the marketplace.
So the smallest available package
Package.
would correspond to the NDC number.
Do you need to mention that in what Tom puts into the statute, the NDC number?
No. You can put down, if you wanted to, the smallest available package with an NDC number. But I think it's an overkill, but
Wouldn't that,
then you gotta define NDC.
yeah, let's just do package.
Yeah. And we took care of the other one as far as the label and relabel and so forth. As long as they don't control the price in the marketplace, they get excluded. So if somebody's taking a bottle of 55-gallon drum with tablets and packaging the smaller containers, just because they're repackaging it or maybe relabeling it, as long as they don't control the price in the marketplace, they'd be excluded from the requirements.
Right.
That's it. Members of the Prescription Drug Affordability Board, this is coming from current statute, not the one being proposed to change. So once the statute goes through, we can change the rule to reflect that.
On page 2, a third of the way down, where it says the chair shall evaluate the alternate member, I think you need elevate.
Yeah, especially when you've got a bunch of docs around.
Yeah, exactly.
Who knows?
What would that look like?
No one
You
knows.
couldn't put it on Zoom.
My equipment's not portable.
And I do want to point out in this section, the wording has not changed from what it was prior. I just fixed the formatting to align more with rulemaking.
Right.
I think most is coming right out of the statute.
It is, I took it right from the above paragraphs and just kind of reformatted. And you'll see I had done that a bunch kind of throughout, just to align with how OLS likes the drafting of rules.
So page 2, page 3, I guess like you just designate, okay. More formatting and Allison.
Absolutely, yep.
There's two places where it says evaluate.
Oh, no.
I didn't see the second one.
Page 2.
In section 3E.
Oh, yeah. Gotcha.
Do you guys have a structured copy? Oh, yeah, you do. Yep.
That's
Printed
also,
up a different way.
and Senator Roosevelt, another one you found?
On page 2 in C at the top.
So there's actually 3 total.
Oh,
3 total, okay.
There's one in B, one in 3E. And then on page 1, 1A.
So those sections were actually struck out and you shouldn't be seeing those.
Okay.
So,
Yeah.
All right,
So
But-
it
but
should,
in-
it's just in that one B.
B, that's
Yep,
the one. we're
That's the
talking
only one,
bigger,
yeah, and
okay.
I just circled it to make sure.
geez,
all right.
I'm doing that. This is not even that.
about. No, it's crossed out. This is the
As far as the advisory council, that's coming again right out of statute.
crossed out, except for the first one. After the Senate,
Everything else is gone.
and the same thing is after representatives.
Okay.
Third one, C. After governor.
It's struck.
Yep.
Done.
Yeah, these are not up to date. This is the one that's up.
Okay.
Oh, there you go. All right, we're good.
Okay.
We're back.
All right. So on page 3, I believe that's pretty much right out of the statute. Well, but can't change that. Okay,
And I do want to note too, so when you're drafting rules based on a statute, you are more than welcome to beef them up. So it doesn't just have to be the statute put into rule. If you need to add things to kind of clarify, you can do that. You can of course reformat like I have done a little bit here more for rulemaking. So just keep that in mind going through.
so could we, then at that point in time, instead of going through the amendment that Senator Sherman was talking about, the small available package, could we somehow clarify that here? So it says that the pricing unit means smallest amount?
Your definition. You cannot.
Can't say.
No,
Okay.
I'm
All
sorry.
right.
That's a common question.
Nice try.
It is a common question.
Definitions of definitions, all right.
Yeah.
Got it. On top of page 4. I believe that's pretty much coming right out of the statute as well.
Yeah, so that is also word for word from the statute. But this is a good example of the statute being very wordy in one subparagraph. Where sometimes, of course, you have to, and you want to keep the intent of the statute.
Mhm.
But this is where you would wordsmith it a little bit
Okay.
to make it more clear. Or maybe break up the paragraph a little bit. And I always like to use somebody from the outside should be able to pick up your rules and be able to understand them. And I had made a comment here, it's still very wordy, because I picked it up and I looked at it, read it, I said, I don't really understand this. How can we make it better? I kind of wordsmithed it a little bit.
Mhm.
If it's something you guys want to keep in that one paragraph. And then I always say, we can do the best we can. And then once it gets to the OLS staff attorneys, if they really find issues with it,
Yeah.
we can revisit it.
So are people comfortable the way it's worded now? All set?
Yep.
Okay. Then you had a note here on
Yes.
going down to number 2. I'm not sure if this fits in the list. What are we trying to say here?
Yes,
Correct your comment.
so this is an example of, again, something not being very clear to understand. And when you're rulemaking, if you can see up how there's an intro paragraph in E, it's that intro statement, and then your list. You always need to make sure your subparagraphs after that initial intro, you can read them together as one sentence. So you should be able to read E and go right into 2. So if you'll see at 2, it just says data compiled by the Department of Health and Human Services, period. That doesn't fit with E, which makes it very unclear to kind of understand what you guys are trying to say.
Isn't it a separate
Is that sense?
topic though? It's like 1 and 2 are 2 different.
Yeah.
How we handle data.
So, and if that's the case, because E1 and the list after 1 makes sense. If 2 was something that instead of having it number 2 based off of E, we could always re-letter it to its own standalone subparagraph. That way it doesn't have to fit with the formatting of E. If that makes sense.
Makes sense.
Okay,
So instead, make that F and then F
Yeah.
becomes so forth.
yep. We would have to work in that first sentence though, just to kind of see what we're trying to say. Or is it saying the prescription drug spending data provided to the board under this subparagraph? So is it information that's provided from the department?
That's a good question. I think what I'm reading into this, and I'll be glad to listen to other people as well, is that when the board receives information that's considered confidential, it shall remain confidential to the same extent in which it would be confidential in the custody of the entity itself. In other words, if I'm a manufacturer or somebody else providing information to the board, and I label it as confidential, it remains confidential as if the entity would have used the same prerogative when they gave it to somebody else within their own organization.
Yeah, so if you wanted to under, if this is going to be labeled F, it could be confidentiality of data compiled by the Department of Health and Human Services. And then the next sentence makes sense. Okay. Does that have to be a full sentence?
Yes.
Okay, so how about just data compiled by the Department of Health and Human Services shall be confidential?
Yeah.
And then you have the next sentence, which says how confidential.
Yep.
Makes sense.
Right, I would just suggest that, I mean, the whole idea of this statute, I'm gonna come back to it from day one. Prescription drug prices were to be addressed, and it was a bipartisan approach to make sure that we have transparency in this, and that people understand what's happening, you know, with prescription drug prices. And here we have public payers, probably, and collectively, some 15,000 employees in New Hampshire. So as goes that subgroup of 15,000 employees, so goes the rest of people in New Hampshire. So I do think it's important that we don't do anything here that's going to undercut the statute's intention for some transparency, so that we're all clear. I'm not saying we're doing that. I just want to reinforce that was the intent of this statute, and it seems to me continuing to be the charge of this board, to be sure that we get to those issues, and that we absolutely need to be mindful of confidentiality, and woe to any of us who run afoul of that, because I don't want to be in the crosshairs of a pharmaceutical company who feels as though somehow some of us disclosed in any manner a trade secret. But I do think it's really important that we want to make sure that these rules don't prevent us from getting to the data we need to get to provide, for instance, those 25%, the 25 drugs that had the highest year-over-year increases, the 25 drugs that I think were most widely prescribed. Those are important things. So I'm not sure we're doing that, Mr. Chair. I just wanted to just
I
underscore.
think I hear you saying is that it's kind of like in the medical world, when you have patient health information, you want to protect the identity of the patient, but you don't want to lose the ability to mine the data for public health reasons. I think we're talking about the same thing here, is we want to have the ability for people to submit the data, but not to the point where we're aware of the confidentiality of the patients, if you will.
Correct.
But it stays at that level. That's at the board. When it gets released to the public, as far as transparency about what's happening, we can release data as far as in an aggregated sense.
Exactly. In an aggregate, it's the flip side of us trying to expand the statutory constraints and definitions through the rules, which we can't do. On the flip side of it is, I don't think we can abridge what the statute expects us to do by more restrictive rules.
Correct.
I would just add, though, this is probably one of the most critical components of the bill for developing trust between us and the pharmaceuticals. So I think we have to get this 2-sentence thing right.
Maybe you need a sentence in between, because one of the things the department does is it aggregates and anonymizes data before it may make it available to us. And
No, actually, that's not the case, because we're all sworn to a level of confidentiality that would allow us access to specific data.
specific data.
And that's one of the other things we talked
It's
about.
what's released by the board outside of that cone of silence that that then has to be aggregated and be identified.
And I think to that point, Senator Sherman, is the fact that that level of detail should be restricted to board members of the alternates here, not to the advisory council. That's it goes back to the
I
same
have to
thing.
go back to the
Go back and look at it
statute and
because,
look at it, because I think that was the intent.
right, for the board to have a level of awareness and knowledge that would not transcend itself into the advisory council, because it's getting outside of the control report. Right. And I don't know about this. If that's the case, we should be clear about this too, that stops at the board level. It doesn't go beyond the board.
Right, but I think that the department may give us non-anonymized data that we may need to make certain decisions, but we're not going to be responsible for anonymizing and aggregating that data. That's not a job that any of us are going to do. So they may also give us anonymized and aggregated data that we then would make part of the transparency process. So I think we need to clarify that both paths work. Because we're not going to be anonymizing data.
No, but you bring a good point, because if I understand what you're saying, that the data coming in is going to have to be analyzed by somebody or somebody's. And that's where it's going to get,
I think we absolutely need to have the trust of the industry,
yes,
and And we absolutely need to be faithful to the trust. And we absolutely need to have the transparency that's woefully lacking, which was one of the reasons why we have this board. So that's the challenge. And it is a difficult one for Senator Sherman to make sure we can do that properly. But I would remind everybody that the rules for disclosure are draconian in their remedies.
Yeah, that's fine.
Are we, is it later in the rules that we talk about handling of the data once it's in? This is data compiled by the department, so this is sort of the compiling the data, but do we have any later reference to confidentiality? I believe we do. I thought we did too.
Yeah.
But maybe we should keep going and just put a mark here that we want to make sure that we cover the confidentiality, not only how the data is stored or acquired, but also how it's handled and then how it can be released. Because it can't be released. Yeah, you know.
Correct.
I am going to make one other suggestion. I think we should stop F after the statement about the department, and then at prescription drug, make that a G to split them up.
Like this is G instead.
Yep, so starting at prescription drug, that will be a new subparagraph. So you'll have one statement and then your second statement about the prescription drug spending. And in rulemaking, so is after this subparagraph is confidential, we will have to change that to shall be.
Okay.
And that's very much an OLS rulemaking language.
Oh, I see what you're doing. That makes
Yeah.
sense.
So you have one statement, second statement.
Is the second statement, is that a subparagraph?
Nope, it would just
It
be
would
a G. Yep,
Another-
it would be its own.
So F becomes G.
So
What is
the first sentence in F will stay F.
Yeah.
The second sentence will become G, and then we'll re-letter so forth after that.
So based upon the prescription drug spending data
That becomes
received, that's going to
H.
become H,
H, yep,
and G moves with the down
down to I, yep.
Okay. Down one. Okay. I think that's also coming out of the statute too.
If I may, Mr. Chairman,
Yeah.
100 is basically a recitation statute with some minor alterations.
In what is now, where are we now? on this?
We're on page 4, and the last one I had was G became I,
So we're moving on
down
to
to 5,
the new H.
the new H.
Chairman, just a
Yes.
quick question. So you're working off of a different draft than what was posted for the public to see?
Yes, because she made some,
I got you.
sorry.
Do you need a copy? of
Need a
it?
copy of it? Here's the copies.
Here's another one.
So is this now referred to as draft version 7? It's draft version 6.
It
dated
says
3/18.
draft version 6, but it
Point one.
should be 7 probably.
Yeah, my 6 is different from your 6. This is, yeah, but my page is different. Okay, so this is your page 4, and it's different from my page.
Heidi, do you need a copy of it?
I think
Yeah,
I'm
copies.
sure, yeah.
Yeah.
I think there's one right next to Bill Marsh.
I can go make an extra copy too. I labeled the one with Allison's comment 6.1, because I figured 7 would be
Just-
after the.
Just the,
Is this different than the one that was posted?
Yes,
Very slightly.
just slightly.
I have two.
I can go make copies if necessary.
I have two.
Too.
That's what you-
Yeah, this one says 324.
Bill, it just needs to have the crossouts on the front page.
And you'll see the draft that I work off of. I also added a header at the top. This is draft initial proposal with the date that I worked on it.
That's the one we're seeing on the screen now, right?
So that's 3/24/22. You see that, Heidi? It's-
Yes. I thought the one that was maybe posted was.
Okay, perfect. Yes, so the one on the screen is the most up to date.
Does everybody have one?
Yeah, one.
Thank you.
Do you want us to run back through it with the? You guys are all
You
good?
good?
Heidi, you okay?
I'll catch up. Yeah, I'm taking notes, so. thank
Okay.
you.
Okay. Good, good.
So we're down to the new H, right, Gary?
There's no, yeah, the new age. Which starts with what I have here is based upon the prescription drug spending data.
Yeah.
That's the H, the new age.
So that should be, under new H, is that A through G?
Yeah, so your citations will need to be
Okay,
changed. Yeah,
so A through G.
Yep.
And E above remains the same, right?
yes, yep.
Now, when you say E above, we have to go back to saying 1E, or does that need clarification?
So based upon the prescription drug data spending received in accordance.
E
Because there
above,
are two E's above.
yeah.
So I think that would just stay E above.
Okay.
Yeah,
Okay.
yeah, because after I changed that E citation,
Senator Rosenwald?
I just have a question. In E, the board may consider the following data. Why is it may there when it shall other places? Is that statutory or is that the decision?
so typically in rulemaking, a lot of the times in statutes, may means shall. You can, yes. This is, OLS tells us this very often.
Why do we spend so much time arguing?
Please, I spend a lot of time arguing may versus shall as well.
I know and needs or.
So normally, and I think I had said that too, later on, I had made some comments about the use of may allows for lots of discretion. And in rules, that is not what we want. That is not what OLS likes. And unfortunately, when you have discretion, it allows for oral rulemaking, which then allows the committee to object to our rules. But there are times when you can use may or might, and that's when you have discretion, but you have clear-cut criteria on when you might do something or when you need to do something. For this, may consider the following data. Unless are you requiring all of this data?
Well, that was my question of the chairman. Has this committee decided that may is better? Where shall is used other places?
That's a good question, Senator Rosenwald. Part of it, shall, that means we're not gonna have any control over what data we want to analyze. If it's a may, then we have some more discretion, to Elsa's point about what data we want to request and work on. So I'm not sure we want to put shall in there because then it opens up the floodgates to everything coming into us versus having some discretion over what we want to ask for.
If you add shall, it would require only the list you have here with the A, B, C, D, and E.
Okay,
that means that you are always requiring all of that data to be analyzed. If you want to leave it as may, that's something we can definitely try, where it's more, you're not putting the requirement on anyone else. You're saying you may analyze this, that, and the other.
But it still gives the board the ability to require getting all this data.
Yes, yes, but
you
it
don't have
doesn't
to
give you
ask
the
for it.
ability to give you, to allow, to ask for anything additional.
What you could say, including but not limited to.
Oh, yeah, we can
Yeah,
do that.
do that.
It was a real
Yeah.
question.
No.
So, and if
Did
that's
you want to
something,
leave the flexibility?
I want the flexibility because if, I want the requirement that we have the right to get the data, but not the requirement that they analyze everything submitted to us.
okay,
And that's what I'm trying to walk a fine line with. So if we do, I think your suggestion is great, including but not limited to, that way there helps the,
so my suggestion then would say, the board shall consider the following data to accomplish its duties in A through D of this section.
In statute, it actually uses the word may.
Yes,
So
But
you
when-
can't change it to shall.
yeah, yes, yes, again, and OLS will ask us to.
Oh,
When you see may in a statute, it is drilled in our brain here who write rules that may mean shall.
Is that in the statute? I mean, the RSA's say that in the defined terms? I've just never seen that. I've just never heard that.
No, but it's how the OLS staff attorneys require us to do it, and because may allows for oral rulemaking, which is a violation of RSA 541, and they can object.
so this should read under E, should read the board shall consider the following data to accomplish its duties.
and I think,
Yes,
I think it makes sense that we shall, when we're doing our duties, shall consider these
Yeah.
elements,
so
but
you're saying you shall consider exactly.
right,
Yeah.
consider.
Because then if you look at one, public payers prescription
That
drug
makes sense.
spending data, upon request notwithstanding any provision of law to the contrary includes, and we could say includes but is not limited to, and then you have your additional list.
So the board shall consider the following data, but not be limited to this data to accomplish this duty.
So one, we would be changing, oh, that's how the statute is.
That-
Including. So it was may.
So include, the use of including there gives you a little bit of discretion.
And that's what's in the statute.
Yep.
including.
And because you shall consider something, doesn't necessarily mean you'll use it. Because you're still considering.
So if we do, so that's part of our evaluation.
Writing rules is an art.
I'm with Senator Rosenwald, but we spent a lot of time over shall and may in committees. Okay. We all set with that part so far? Okay, on to page 5.
Mr. Chairman? Can I ask you a question? All right to ask you a question?
Yes, yes,
I was getting back to the concern about confidentiality in that paragraph labeled 2. Right there, yeah.
Now,
Does anybody feel that having confidentiality be the same extent as the entity that provided the data, reasonable? Or what my concern is, I guess, if you're trying to really make sure that the data is confidential, that you have the confidence of, the drug manufacturers, patients, data and stuff like that, would we not want to have a statement of confidentiality that is more specific and not necessarily related to the previous entity that provided the data. This is, to my mind, I'm reading that saying it's assuming that their level of confidentiality is without compromise at all. So does anybody else feel that that reads differently or the way I'm reading it?
Well, it's what's in statute.
I understand, yeah, but is it the same confidentiality level that we want to have?
You raise a good point, Representative Murphy, because as I listen to what you're saying, how would we know what the level of confidentiality is of the entity if they don't explain to us what that level is?
Well, that's what I'm asking, yeah. And
Right.
is it a gold standard of confidentiality is what I'm asking.
But
If we have strong penalties for any breach of confidentiality, which we do, right?
correct, but how do we know we've reached their definition of confidentiality?
Well,
Because
what I'm getting at is that if we have those already in place, I'm not sure how it can be more confidential.
But it says to the same extent, which means to me.
No, I
it's-
understand the problem. I'm just saying that if it's punishable by draconian measures, I'm not sure how much more. You just can't breach confidentiality, which is it's kind of yes or no.
Should we-
It's not-
should we then?
Yeah.
Mr. Chairman,
Yeah.
can I ask a question?
Yeah.
Just on that point, are we talking about the confidential data that you can actually sell?
No,
in the statute?
No.
What data would that be?
Data I could think about would be when you're getting into, you set a price point that exceeded the parameters of the statute. And you then disclose to the board why you set the price point above that trigger point. That's confidential data. It's your pricing, internal pricing policy to how you determine that. That would be some example of confidentiality.
What about the list and the rules here?
I think why don't we go through this in order rather than, I think we're getting off the
Yeah.
order.
Right.
We'll get to all of it.
Yeah.
Eventually.
I think this is addressed later on because where it is, I'm not sure, but there's another section here dealing with confidentiality.
Right.
And that may clarify things.
Well, I see Jim's point,
Yeah.
but this is the way the statute reads,
Yeah.
so not sure we should.
The only thing I would possibly think about adding to it is that the entity who supplies the confidential data needs to at the same time submit their policy, confidential policy. Otherwise, we would not know how to address it.
We do that in rules.
We do that in rules.
Oh, absolutely, absolutely.
I'm saying, because we need to understand where they're coming from, because otherwise we don't know we're in violation of anything.
I think we should see, or take a look at the other confidentiality section, because where you guys are aboard, your 100s and 200s are pretty straightforward, and it goes for every board that is out there. Your organizational rules and your practice and procedure rules. So that would be something I think that would go more into your 300s, which is the meat of your actual rules and what you guys are doing and how you're using this data, collecting this data, storing this data. That's where you would find that information, would be in your 300s.
All right. On to page 5. One of the things that I wanted to bring to your attention is under it's 8I 1, 2, and 3. The 25 most frequently prescribed drugs in the state. What's the metrics? Is it the number of prescriptions written, the number of tablets dispensed? Is it? It gets back into the smallest package size, I mean, how do we measure? I think it's probably based upon the number of prescriptions written. That's kind of what I would think, but I was looking for the board for some direction.
Not to spend it.
So basically, what we have in the all payer claims data is the number of prescriptions for a particular drug. Where it gets somewhat different is the prescription, of course, could be for 30 or for 100. But I think if we're using some sort of a benchmark, we go by the number of prescriptions because that's the activity.
And that's available
And
data.
it's available data.
And if you go for something else, you're not going to get something that you can even get, and it becomes totally impractical.
Correct.
Well,
So
and
we
also
okay using
prescription,
them?
I think you're right, that the prescriptions are, to me, the metric I would want to know, because each prescription may have a different, number of pills, number of doses, that sort of thing. So you just want to know the frequency of its use, I would think.
Okay. So we all on board with prescriptions? Again, the same thing is when you deal with 25 costliest drugs, this is one of the things that we need to think about too, because there's two different markets for prescription drugs. There's the market, that's what I call a community-based, if you go down to Wall Street, to Walgreens and so forth. But just also in the medical benefit side, a lot of drugs that are billed through the medical benefit that are administered by the hospital or administered by the physician's office. So when you talk about the total amount spend, are we talking about the outpatient, the community pharmacy spend? Are we talking about including the physician hospital spend?
I think if you include the physician hospital spend, you're going to get into some very esoteric items that are exceedingly expensive, used for chemotherapies or immunocompromised patients or whatever. That if we start to work on their costs, because they're brand new and very expensive, we're basically going to be denying their availability to patients in the state of New Hampshire. And that's not in the interest of the patients. Whereas I think our intent here is to reduce the cost of drugs for people. And what they care about is the community pharmacies, because that's what they pay out of.
Right.
My thought was, really, it's the, just think this through, the unit cost by the number prescribed.
If we go back and look at, if we use the definition of prescriptions, that's prescribed, that's the outpatient community pharmacy activity. Because
Well,
inside of a hospital or physician's office is what's ordered.
yeah, but some of the most,
Costly.
I mean, for example, if you're doing Remicade, the annual cost of Remicade may exceed many others. So it's, what is the cost to the payer? Which may be the state.
Mhm.
I mean, it's supposed to be the state in this. So is Remicade more expensive than hydrochlorothiazide?
Yeah, it is, and it's obviously rhetorical, but the other side of the coin is they're projecting by 2026, 60% of the drug spend will be on the specialty drugs like Remicade and so forth that are going to be outside of the community pharmacy.
And we had this discussion with Heidi. Sorry to pick on you, Heidi, but it's a positive pick. So, we were talking about the cost of specialty drugs by pharmacy. So if we don't capture that, markups because it's in a hospital, if we don't capture that, we're not really capturing the cost to the payer, which is the state, and that's our focus. So what is the best reflector of that cost? Again, it may not be, I try to get away from the word price because we have nothing to do with price.
If you get the hospital payments, you're going to get into bundled payments and things that you're never going to be able to sort out the data time.
What about outpatient? Right?
Outpatient, you could probably include because it's
You
not
could
bundled
do
the same way.
outpatient. So this is something that we've been talking about with the payers. I know this is a little bit off topic, but we've been talking about payers and the site of service.
Mhm.
And so that's That's part of the cost to the state, is where is it being done? So it's the administration. I'm just trying to figure out how to capture that though. It's not just the cost of the drug itself. I don't know, Heidi, I don't know if you have any thoughts on that. Again, I'm sorry to pick on you, but you've been working on this on in other spectra.
Yeah, I mean, I would agree that I think it's a really important piece of the cost picture, and if that's not captured somehow, then you're really missing what some of the cost and expenditure exposure that payers have.
What's that package? It's not, it's the product, it's the administration. I don't know if this,
Right. I think the insurance department does have some amount of data on that. Off the top of my head, I couldn't
right.
tell you what that is, but I do recall seeing that sort of data in their annual reports. So
If we,
I think there's some available.
I don't know if we can, I don't know if the statute allows us to get to that level of depth, but we want to be careful that we're not under evaluation. You know, in other words, skewing our evaluation based just on the cost of the drug itself without taking into account the site of service.
I think that's right. And the statute doesn't, I don't think.
I don't think it gives us that power.
Well, I don't think the drafters were being so precise to make a distinction between prescription and order.
Well, you've trained me since then, so.
No, I'm saying, I think prescriptions were meant in the very general sense
Right.
that prescription drugs, regardless of site.
Well, at the very least, I think we as a board should be aware of that additional variable when it comes to the cost to the state of these
Yeah.
medications. I don't know if this is the place to capture it. Might be too
Well,
difficult.
I would, if this first go around, to keep it moving forward, is I suggest we just stay on the community pharmacy side of the equation right now, because that's the cleaner data that we can have access to. What I can do is reach out to Tyler at the insurance department to find out what's in the database before we go down a road to your point. Or it's March that if we can't collect the data, we don't have a database to analyze it, then we're not gonna get no wheels, right? So I'll follow up with Tyler to find out what's in the database as far as the physician and hospital spend. I think it's an important one, but we have to wait to track it. The other question came down to, when we talk about the spend, or we talk about at the wholesale acquisition cost, the actual amount spent, when you say that, is it the amount spent by the patient, the amount spent by the person providing the coverage? What's the spend? What's the cost to whom? Is it the cost to the patient? Is it the cost to the state collectively, including patient's copay? I know we're getting into the grass here, but the weeds, but it's important. So,
Well, I think most helpful would be, certainly would have to include the cost of the state.
now, when you say the cost of the state, you're talking about what the state paid, not what the patient paid in addition to the state.
We might want to include the patient cost as well, but certainly because we have to raise tax revenue to pay for the state's cost. And it's the bigger portion of the spend. Maybe it's a net cost after rebates.
Mhm.
Well,
But the
that's
other-
part of the whole equation. It's trying to be as smart as we can about the use of rebates and co-pays and all this.
I see it as the aggregate of reimbursed costs and co-pays less rebates.
Mr. Chairman, you have a hand up behind you as well.
Thank you, sir.
Yeah.
Mr. Chairman, if I may, I'm one of Heidi's assistants over at Gallagher office. I may be the only one that's trying to follow this, that doesn't understand how this works, but if that's the case, I apologize, but in order to look at whatever this draft, the recent draft does, I think it's necessary to understand fundamentally what it's you're doing. And so on the area you're talking about, public payer is the state, it's 10 counties, it's 240 towns and cities. When your board determines the spending target for government across the state, including the 10 counties and the 240 municipalities, is your spending target the same for the state, in the town of Hopkinton, in the city of Manchester, in the city of Berlin? Or are you as a board going to establish a spending target for every one of those governmental entities?
It's a very good question. I would say until we get some data to analyze, I have no understanding of how disparate things are. If they're relatively close or not. But the fundamental goal of the board is to use taxpayers' money as wisely as we can. Because the burden to the taxpayer is huge. And
No, I get all that. And I understand that you simply took the statute from Maine and passed it here in New Hampshire.
That's just not true. Let's not go down this road, Mr. Chair.
And
Why don't
actually, it
why don't you
is
sit
true,
down?
Senator.
I was the prime sponsor.
Well, then perhaps you could answer that question.
No, I don't want to get distracted from what we're trying to get done, and we have limited time. I'll be happy to talk with you afterwards.
we have.
And we have public comment section.
We could talk about this during public comments.
Oh, I thought that's what you were doing.
No, this is.
You're gonna have public comment at some other
No.
time
There's time on the agenda for public comments, correct?
on the rules.
Yeah.
Oh,
On anything.
All right. Yeah. So basically, what I'll do is I'll reach out to Tyler and find out what we can find out, what he has in the database, because if we don't have a way to measure the metrics, then it's not gonna be helpful to us. So I'll reach out to Tyler and find out, A, what we have with the medical side versus the pharmacy side, what we have with patient co-pays, the net paid by the state, and look at the data, because if we can, at that point in time, break it apart, we could also look at it and saying on certain drugs, we look at it and saying 25 costliest based upon your point, what's the aggregate between the patient and reimbursement? That makes sense? And again, the same thing, year over year cost increases. I would say go back to the change in our definition to the lowest dispensable unit would be the package size. So it's the smallest package size that we're tracking. Because we have to have some way, because if you look at any kind of medication that can come in a bottle of 30, 100, 1,000, we have to have some consistency across it. So I'm saying we should go back to what we talked about for the pricing unit, which we're trying to do, hopefully, Senator Sherman's amendment, that the smallest package available in the market to dispense the unit.
Are you talking about 3 here?
Yes, talking about 3.
So what are you suggesting that we do?
We look at the lowest package size, the smallest package size, which goes back to the change we're trying to make on the pricing unit. Instead of it being the lowest dispensable quantity, the smallest package size in the market that the pharmacy would order, and use that as our consistency across.
Well, that's assuming that the aggregate spend increased because the cost of the lowest dispensable unit increased. It might have changed because suddenly people are suddenly prescribing something that they never prescribed before. Like, for instance, I suspect in New Hampshire, the aggregate spend on ivermectin in the last year hugely increased, and perhaps more than any other drug in the state of New Hampshire, and probably had nothing whatsoever to do with the price of the drug. So, you know, we're going to have to look at these specifically and individually and ask ourselves, why did this happen? And then make some kind of a decision.
So I'm just a little confused here. I thought this was pretty clear that this is the This is cost, not price. And it's cost increases
Correct.
by the total amount spent on those drugs. So it's not necessarily that the drug itself became much more expensive. It could be that the quantity used
Whatever.
Went up
went up.
80%.
Utilization.
So it's, again, it's getting back to price times utilization for the year. Right? Or am I missing it?
I agree with your assessment here.
So it wouldn't be unit, it would get back to unit cost plus number times number prescribed over the course of a year.
You could have a situation where, for instance, you have a supply chain interruption that, right, and that could happen.
Mhm.
But as we report this every year, it would be important to sort of underscore what those drugs were that were affected by whatever reason. May have been a manufacturer choice, it may have been a supply chain necessity, right? I mean, is that your point too? Is it, it doesn't?
Yeah,
that's-
for whatever reason that the utilization changes, there's two real variables here. There's utilization and price or cost.
Correct.
And so the total cost per year is the total utilization times the actual unit.
Right, to Todd's comment, if there's a supply chain interruption in a particular drug, so the total aggregate spend on that drug in that year went up. We might look at it, we'll include it in our report, and we'll say the supply on this drug went up because of this particular reason, and we recommend no action because that's.
Because it was a supply chain disruption.
Right. Okay, so, the fact that we're including it in our report, we're taking the 25 with the highest aggregate amount, we're just picking those to look at. Right, and then we'll have to make some kind of decision.
Mr. Chairman,
Yeah, but
just a question, with number 3, I think that brings up the point in my mind, are we trying to get at the increased price per unit or lowest, the smallest packaging unit, or are we just trying to get at the total cost spend? Because when I was thinking about the purpose of the committee, the board in these rules right here was, I'd be most interested in, the increase per unit of a drug and why did that happen versus all of a sudden there's a huge flu, outbreak and, a drug went up by volume, but that could actually be put in as a parenthetical comment versus what my intent was to think about what the actual price per unit was. How did that change? So 2 different questions, I guess, or 2 different
well, no,
focuses.
I think what I'm hearing is the fact that this is kind of like the old A times B equals C.
Right.
And A is going to be utilization. We discussed utilization is going to be number of prescriptions written. So that's utilization. The cost of the drug for that prescription would be the B, and the total cost would then be C.
Right,
Exactly.
and to me, it looks like number 3 was focused specifically, initially at least, on B. What was
On B.
what was the cost per unit? Why did it go up? Was it the, for whom did that go up? So, and I was thinking that you could even put number 4, if you wanted, the A plus, times B equals C, or just to parenthetically list it somewhere else.
So Sherman, you had a question?
Well, it's just, yeah, I agree with Jim. I think if the goal here is to understand what's the most expensive, that's 2. What's the most rapidly rising, or one with the greatest rise, we're going to need to have the data that we can go back and say why. So part of that database is going to need to be cost and utilization to understand why it is. So I think all the above is the answer here. You need to know what's happening in utilization, what's happening in cost
Well,
on both of them.
here we're going right from the statute. The statute says the 25 drugs with the highest year-over-year cost increases as
Right.
determined by the total amount spent. So that takes the 25 drugs we're going to look at.
Right.
Okay, in analyzing each of those 25 drugs, we're gonna look at all these different factors. One of those factors might be that suddenly there was a huge increase in the minimum of the cost of the lowest dispensable unit on that drug. So in that case, we'll focus on that issue on that particular drug. The other 24 of them, it might be something else. And we'll say, well, that's not a problem that we need to address.
Right.
But, yeah, and I think that basically this is coming pretty much right out of the statute. So we stay with it. The only thing I was looking for was prescribed when we're dealing with the community pharmacy, which is what I wanted to clear and get that taken care of. Let me talk to Tyler, maybe have talk about what's in the database. I did reach out to Andrew at the Department of Health and Human Services. He said for the May meeting, he could get some numbers for us till we start looking at some actual data to help guide us.
Can you add in on that? You know, I agree with Bill, is that it's a total spent by the state, which is your equation, Gary, A plus B, or A times B equals C. Can in this, based on that last sentence there, can you actually add, I'm not sure about rules, but could you add, based on NDC, then you have utilization rate, comma, then lowest dispensable unit. So can you add that at all in rules, or does that have to stay as it currently is written?
So in rules, you can, as long as you're not changing the intent of your statute, you can add what you wish. I don't think you cannot require less than these three in your report, for your report, I should say. But I don't see anything that's preventing you from adding anything additional.
Right.
So,
So the statute says we got to look at these 25 drugs based on the aggregate cost. Once we pick which 25 drugs we're going to look at, we could then determine what was the cost of the lowest dispensable unit of each of those drugs and see if that was a factor in the cost increase. And we can elaborate on that. That's what we specifically want to look at in the rules.
Representative Murphy, is that okay with you?
Yes.
Okay, all right. We made it through the 100s. Okay, on to the 200s.
Okay, so here, I was kind of skimming through. I really think I didn't change a lot here.
I see a lot.
Yeah, no. So what I did, I added the chapter heading, practice and procedure, again, because that's very typical for a board, and also a requirement rulemaking for a board. I did note to remove the authority section, which is currently 20102 authority, because you're really just stating your authority for these rules, and that's something like I had done at the top. You can just add in the statutory authority with the RSA. You don't have to have a separate section for that. And then I just kind of beefed up your purpose and scope a little bit.
On to page 6. I saw you had a note here about under 202.01B, whether 3 weeks would be sufficient for someone to notify the board.
Oh, yeah.
Where is that?
It's under 202.01B towards the bottom.
Oh,
Is that-
okay.
Page 5.
Is 3 weeks sufficient prior to a scheduled meeting, which, did you go down that far? Are we down there?
That's statute.
202.1. Yeah, right there.
Mhm.
3 weeks sufficient, or you think we should go more?
Well, that's, I put 3 weeks there as kind of, because it made sense to me, but that's other, I don't think I'm the one who decides that 3 weeks is sufficient. So I think it's a question for the board.
Well,
That's statute.
I probably would say 3 is the minimum. I'd like to go to 5, and I'll tell you why. Right now, we have to provide notice to the board meetings 2 weeks ahead of time. We have to have everything on the schedule at least a week before that. So that only allows for probably at best 2 weeks for someone to get things together on the agenda. and sometimes agendas get kind of crazy. I think 5 weeks give more time to do the planning discussion back and forth if somebody wants to be on the agenda. Are you folks okay with 5?
Reasonable to me.
Can we change that?
That's rule.
Yes.
Yeah, that's not the statute. That was something that I drafted.
Should we say excluding public comment? Because
Oh, yeah.
anybody can come in public comment and they don't have to give us notice that they're going to talk about it in public comment.
Is it including or outside of?
So I envision that provision to mean somebody who wants to have a planned presentation to the board. Requesting to appear in a plan, so not the public comment setting. So yes, to exclude public comment is my perspective.
On page 7. Something else on, anything on page 6 that we have to review, or you all set with
No,
that?
just there's some elasticity in the rules, so the board can relax things if it wants to, right? So in the event somebody did, if we had a very light agenda, and
Sure.
somebody came in 4 weeks before and said, can we get on the agenda, we could certainly permit that, right?
Sure.
Or we could, at least 5 weeks prior to the scheduled meeting unless approved otherwise by the chair.
Well, you have, under F, you have the board may waive the
Yeah,
requirements.
I think
That's
you're
part
okay.
of
So
its
we're all set,
discretion.
yeah.
So I
Yep, all
think
set.
they're covered.
Do you want to have that, the board, or you? Because what I'm trying to get to, we want to waive the requirement, which is back to the same thing about under B. If someone wants to make a presentation to the board,
Do we have to take a vote on that or can the chair do
Chair,
it?
can the
I
chair
think
do
it
it?
should say the chair.
because otherwise get a vote.
So it would be
The chair,
the chair at their discretion.
yes. Okay, on to page 7. This goes back into who is going to be able to represent. And this comes down to, I think, this on to Attorney Barry, is that if the representative wanted to appear before the board on behalf of somebody else, they'd have to be an attorney at law, licensed New Hampshire officer or employee designated by the representative entity. It's just telling who can come before the board on behalf of an entity, which is pretty clear. If the attorney is not licensed in the state of New Hampshire, they can also, at that point in time, if you look at 202.03, write to counsel, maybe before the board. It's commonized on the Board of Pharmacy that there'd be an attorney and licensed in New Hampshire, but they bring somebody else outside of New Hampshire, but they couldn't really speak and practice per se in New Hampshire. So the attorney who was licensed here was taught was that they spoke on behalf of the attorney before the board. They took responsibility for it first.
Yeah.
So. Same thing with number 7, we all set with that?
Yes.
And this does allow for remote presentations so that somebody doesn't have to be here physically. Preference would be in person, but we recognizing what's going on today and also the fact that technology has become more comfortable with Zoom, that we can allow for presentation or representation to be done remotely. At the discussion board. On to page 8.
Mr. Chairman, can I ask a quick question? Just back on your, where it says the representative has to be an attorney, licensed in New Hampshire, officer, employee of the company. So those of us who are lobbyists and come to this group could never speak on behalf of our client. Is that true?
Does that make sense?
But just, what's your thought on that?
Well, I don't fit the definition at all, but I am authorized at times to speak on behalf of.
So is there, do you want to,
So, so would you say change the word employee to individual?
Yeah, I think that.
If you go to it under 202.02A, where it says employee, change that to individual
Okay,
on page 7. It's okay.
202.02?
I think you might want to ask the Attorney General's interpretation of that. You have an unauthorized practice of law potentially, but you don't get to that when you have an employee of the company. Maybe they could define it, maybe I'm wrong, but I would just ask.
Right behind you.
Yeah,
Is this, the appearance here that's talked about, is this limited in scope, or is this any appearance? I thought I had heard earlier that it was limited.
somebody's going to say limited.
Well, I guess I'm looking at the section before this and just picking up on the definition of adjudicated hearing. If it's a hearing that it's applied to, that's one thing. If it's just any appearance before the board for any purpose, it seems hard for you folks to limit, who's coming and speaking. I guess that's.
I hear you now. Now, this is for adjudicating hearing. This is when something's brought before the board because something has gone awry.
This isn't like an appeal.
It's an appeal.
Is there a way to specify that?
That's different stuff.
So
Is there
you're
a way
okay
to
with that?
specify?
Yeah, if it's an adjudicated,
Yeah.
adjudicated hearing, I would think it'd be.
To be an attorney.
Makes sense.
Okay.
Okay.
But do we need to
No.
clarify that so that we're clear that it's an adjudicated?
Well, that's appearances before the board. This was,
It's fairly common practice in New Hampshire that somebody who's testifying needs to have the authority to bind the entity.
Right.
An attorney can bind an entity, an officer or somebody duly authorized by a company can do it. So in an adjudicative setting, it's a different analysis.
if you go back to the beginning of on page 5, 201.02, adjudicative proceeding is what we're talking about.
So we're good.
Yeah. And again, it goes back to the proceedings before the board, how the board is basically run the proceeding. Straight out with that. What I wanted to ask the rule writer or the attorneys as well, under the issuance of civil fines proceedings, one of the things I didn't see in here, and I don't want to bog it down, but I think it's important. When we had before the Board of Pharmacy and we talked about fines, what jail car attorneys basically told the board was you have to have and define what the fines are.
That's in a different section.
Let's give a second. Okay.
Yep.
I missed it.
I believe that's in your 300.
And 300, okay.
Yep.
Thank you.
The 300 has the fines and the assessments, and that's where I do have a note, the board will decide whether to impose the floor or the ceiling on certain things.
Okay. So the rest of this is pretty much straightforward. It's just,
So, I mean, it's pretty straightforward, but I did have a note on here that I'm concerned this may be a little problematic for the old staff attorneys. There's lots of discretion in this section. I think we need to, all the mays, when it comes to
Mhm.
fines, all the mays need to come out, and it has to be a shall, and you need to have some kind of criteria. If otherwise, they do not take to issuing fines very lightly. So it needs to be pretty clear cut for them. And again, we can leave it as close to how you want it as possible, and we can just see what their feedback is. But I do suggest at least changing the mays out to shalls.
It's fine.
One of the things here was the fact if you go back in 203.03, is the advisory council, which it comes down to is on C. Is it sometimes
Hold on, we need to catch
on
up.
page
203.
203,
So where
C.
are you? Page 8?
page 8. Yep. And this is back into the role of, this is something we ran into issue also on the Board of Pharmacy, and using my experience there. When the board is both the jury and the judge, it becomes awkward. So what we did at that point in time is we would allow for the investigators to go out through the investigation. So they became, if you will, the jury, and brought the information back to the board with their findings. And then the board would then make a decision on what the recommendation was from the investigative process. So using that logic, I thought the council, this is a time in which the board could send something to the advisory council. It's not confidential information, it's a question about there's been a breach of some sort. The advisory council can then do the investigation, do the research and so forth, and bring to the board a recommendation, which the board would act upon. So it gives the role for the advisory council something besides, again, to advise us and separate ourselves from making the ultimate decision, instead of doing both the investigation and deciding at the same time. So I wanted to say it may do that. There may be certain things that happen that are what I call very objective. You're supposed to have the report in by the end of January 31st. It came in on March 13th. That's pretty clear. But some other things may arise that it's a judgment call. So I was trying to find a way to separate the board from. Does that make sense?
Yeah, it does make sense, because there could be, it's also a question of volume and resources, right? There could be several hundred appeals that might have a commonality to them. And maybe someone needs to help the board sort it out so that the board could actually make the final determination without hearing every single one. Because think about it, if you thought about, if there was something that came up, particularly with a fairly new board, it could bog this board down for almost a whole year of just getting through these types of proceedings.
Right.
So I think that's smart, the way you proposed it.
So that goes a long way getting back to Allison, because if I look at, again, under C, the board shall assign, can we still use the word may?
If we can clearly say when and when not, you would assign the advisory council.
One,
And I would take out at its discretion,
okay.
because using may is already giving discretion, and at its discretion is a big red flag.
Well, you could have shall at its discretion. Then you've got may.
I don't know if I've ever done that before.
Maybe shall.
Shall possibly.
You could say that the board shall at discretion. That makes sense.
I would replace it with may.
Yeah, the board may. I think we're trying to get to, if it's something that's objective,
Mhm.
it's clear cut, it doesn't need to go to the advisory council. If it's something
Okay.
that's open to interpretation, it should go to some other body.
Okay,
That's kind of what I'm trying to get. All right.
So D is contingent on C, right? If C doesn't
Yes.
happen, D doesn't happen.
And I was wondering
Same
about
thing with-
60 days, because of the council,
So I'm wondering if we should go back to the 1 and 2 under C rather than having them be separate, because they are, D and E are contingent on C actually occurring.
yes,
Yeah, that's a good point, Tom.
a good point. Tom.
so for the purpose of the rule formatting,
Mhm.
what I would suggest, instead of a 1 and a 2, I would say we just cite to C above.
If C is invoked, is that what you're saying?
Yeah.
Okay,
The
Something
version
like that.
shall-
I mean, in a wordy way, you could say, if the board has assigned the advisory council to investigate it, then the advisory council shall. You're gonna have to repeat C and D and E.
Mhm.
And that's very typical. You see that a lot in rulemaking.
All right.
Yeah.
Okay. So it's 60 days from the time it's signed, or 60 days? my concern there is going to be, is the frequency in which the advisory council meets.
I think that's at the discretion of the board. Or at the discretion.
That's the advisory council section, that's BB4. It would be at the board's discretion, I think. There's no,
So how would you want to phrase that, Tom?
Well, it's basically within 60 calendar days of the assignment to those.
I
don't know the
I
best
would
way
like
to
to
say
move that to probably 90 days, because
Yeah,
this is my
60
concern is
probably
that
correct.
the board's got to convene. They have to do the research and then reconvene with a recommendation once it's all there.
So
So
I think 90 days is more reasonable.
Yeah.
And I also, so I was just kind of wordsmithing.
Yeah.
So D.
Yeah.
My thoughts for that would be, if assigned per C above, the advisory council shall within 90 calendar days.
Yeah.
Issue a written recommendation to the board as to the merits of imposing the civil fine and recommended amount of the civil fine.
correct.
So that it kind of ties in the citing to C above and then you're changing to 90 days.
Mhm.
That makes sense. And then you have the whole thing about the appeals down in I, which goes back into how process they can appeal it. On to page 9.
Mr. Chair.
Yes.
I have a hard stop at there, and I don't know if anybody else does. But we have this. Should we plan to? Done, or
I don't think we're gonna get through it then.
so do we want to do the presentation?
That's at 12.
Oh, that's a thought, okay.
And I did that specifically to give us enough time to get through this.
Okay. That's fine. That works. Okay, there we go.
So on to page 9. I think that was pretty much.
Just
normal.
format, yep, I just renumbered. Yep.
Just remembered everything, right?
Yep.
Motions in response, therefore, this is all about this is about the process. If I understand this correctly. Now we get back to the bottom of page 10, back to confidential documents and confidential information. This loops back into what we talked about before. Under 203.08 at the bottom. This is back to the hearing. This is not so much about the information coming to the board, but this information provided at an appeal process. So be clear about that. So if they want to provide us confidential information at that point in time, it will remain confidential based upon what that can happen during the appeal process or during proceeding. Right?
Yep.
Okay. All right. I see you added something, a drafting note on page 11. It's in
Oh.
highlights. Is it here? Drafting note.
That was something Mr. Fahey and I had come up with. I guess I didn't put that into an actual rule yet. I apologize.
Does that need to go into a rule then?
Yeah.
That would be part of, would that be a 3? 1, 2, and 3.
I think that'd be a separate,
Separate.
yeah. Is it the intent, obviously, is just to make sure that we post decisions on the website for review by the public.
Okay, so it would become a J
Yeah.
and just say decisions of board shall be made publicly available on its website for guidance and instructions, to registrants and other necessary.
Yeah.
Okay.
The rest of it, page 12.
Oh,
You've got a note here inside. Under H.
yeah, so it was kind of safeguarding PII, see confidential information tab. I just wasn't really sure what you guys what that meant.
Yeah, I'm not sure where that came from.
Does it need? Do we need it?
What's the heading say on it?
It's a record. Record of the proceedings shall include all the following.
Yeah, so I wasn't sure how
Yeah,
to
I don't.
address that.
I think anything that's shared in public should remain public. There's no reason not to. So
Yeah.
should we just delete that?
Yeah.
Okay. All right. Number- And on page 13, settlement decisions, I think it's all this formatting we did before.
Yep.
Consideration of typical stuff that we got through. And gel card is gonna bounce it back to us if they have a question anyway. right?
Oh, they look at numerous times,
Okay.
the OWASP attorneys, yes.
All right. You made a comment, Allison, on page 14, under petitions, include, it's 205.01 A, and next to the word include the following information. The petition for declaratory ruling shall set forth.
So I have minor wording change, just by adding include and removing the petition for declaratory ruling shall set forth. Yeah.
But that takes care of that issue
Yeah.
there, okay? On to page 15, I think is next to the last. Prescription Affordability Board, this is the question about
So
budgets
this
and so forth.
is your, so this is your 300s. This is your, the meat of what the board does.
Okay.
So this will be all your assessment fees and your
Mhm.
fines and whatnot. So this would be your chapter 300s.
Okay,
For example, I have helped facilitate the milk sanitation board rules. Their 100s and 200s are just like this one. And then their 300s are titled milk sanitations. So I didn't know what you guys, I just added a kind of a placeholder title for you guys
Mhm.
for the chapter. I don't know if that's, if you like that, if you want to change it to something else.
It's spelled prescription correctly.
Oh, that would be helpful.
no, that's fine. I don't see anything.
Mr. Chairman.
Yes,
Just one quick comment on
Yeah.
the declaratory section.
Yeah.
I just want to call out that declaratory rulings can be very helpful. So in the event that the pharmaceutical industry is concerned or some other aggrieved party or is concerned, I mean, they can file a petition with this board for clarity about procedures and other things. So I would just say, I know I'm going back a little bit, so, you know, I know we're pressed for time, but I do think that the fact that we've included this in the rules it's a nice safeguard. And if people are aware that it's here, then it's a mechanism for providing certainty to them by asking this board what it would do on certain situations.
thank you.
Mr. Chair,
Yes.
on the top of my page 15 in A, I think the sentence should read, instead of where she has and include, I think it should state which includes, because I think we want to make sure that the request does include that information.
That makes sense. Yeah. Thank you.
And one other thing,
Yeah.
at the bottom of that page, chapter XXX 300, prescription should have the S in it.
Yeah.
Yeah, it's on, I made that note.
And then on to page 16, which is last, is coming right out of the statute. We talked about the assessment fees. There's a floor, there's no ceiling, but we basically at this point in time, we're putting it into rules. So therefore, in essence, we're capping it unless we go through making the changes. So it stays at $100, $500 and so forth, based upon what was in the statute as the floor. But by putting in the rules, we're putting it in, locking it in. So I heard before that there was no ceiling to it. By putting in the rules, we're artificially creating a ceiling. And as far as the fines, it's also in statute, it's up to $1,000 per day with a maximum of $25,000 per occurrence. So the issue about the fines and so forth has really been the statute defined it.
If I may, Mr. Chairman, the fines are ceilings, so you can go lower.
Always go lower. Up to.
Statute.
And
Mr. Chairman,
should be fine up to, if you look at the bottom line.
can I ask a question?
Yes, so
In F down at the bottom of page 16, that the civil fines and penalties are transferred to the general fund. Is that required by statute?
no, I put that in there because what I wanted to be clear on with the rulemaking, people external to the sport, that we're not levying fines to support the board.
Oh.
So therefore, there's no incentive for the board to artificially fine people because the funds that come in do not go back to the board to support the board activity. We also put in there on this, under E, that if somebody has a financial hardship, they can appeal to the board to ask for a waiver. That was the other thing we heard, was sometimes some of the smaller companies may have a challenge, so therefore we wanted to have them the ability to ask for a waiver and explain why they felt they deserve one.
I'm sorry, I guess I forgot. What is the 15% cap for?
It's not there, but we heard during the testimony about the board, there was no ceiling over what the board could raise for funds. So by putting in a 15% cap, which is also a central chairman's amendment, basically, again, the same thing, the board's not going to artificially levy a lot of assessment fees in order to make a lot of money. It's not, that was never the intent of it. We basically have the ability to cover our costs, but not just artificially.
I just want to triple check on that. Thank you.
Okay.
No. yes.
So, given everything we talked about here today, what I'd like to do is get a board based upon the edits we did. We can wait until May to come back. I would ask the board, with Allison's permission, your permission, to approve this draft as edited by the board. They get them off the gel car. Hopefully gel car will get back to us.
Okay, so rules is a process.
Okay.
We are looking at a mid-August end date for these to be approved.
Mid-August.
Yes, so what will happen now is we'll have to take this draft, take our initial proposal is what we call it, create a fiscal impact statement. That will be sent to the LBA, a 2-week turnaround for that. And then we will set our public hearing, and that's when we officially submit to the OLS staff attorneys for GelCar, and that's what starts to move the process along, because
So-
then within 541A, you have various stages we have to follow.
Senator, Senator?
I'm sorry,
Yeah.
I'm looking at the last sentence of the rules, which is about the fees. I'm wondering, since all other boards pretty much are, they generate their own revenue through fees, but you're saying this board won't. How is this board going to be funded?
No, I think if I can jump in, Cindy has found, or Senator Rosenwald has found a problem with the wording here. That the fees collected by the board shall not exceed 15% of the board's operating costs.
Oh.
So essentially, you're missing 85% of the board's operating costs. So you need to have in there, to be consistent with all the other boards, you want to say 125%.
Yep.
We'll fix that.
125 for the check.
Right, because that's
Yeah, not yet.
consistent with the other boards. as
So we
you
would be
know.
grossly underfunded,
Right.
85% underfunded. Oops,
All right. Thank you, Senator.
thank you, Senator.
My
Yes.
fiscal
Yeah. Okay, so as far as if he can send these over, if the board will accept draft today, we can send them over to LBA for fiscal note.
Yes, so there's another form that Rob and I will work on
Okay,
that we need to submit to the LBA along with the proposed draft.
okay,
We'll also need a cover letter signed by the chair, so I can draft the cover letter and email it to you.
all right,
Or, actually, yeah, so they accept electronic signature, so if you want to sign it, scan it. And then that starts the formal process for rulemaking, but then it is a lengthy one, because we have certain time periods you have to abide by for public comment, and how long it needs to be published in the rulemaking register once we get the FIS back. And that will bring us to about August.
so if we do this, we have another meeting on May 23rd, we have public comments on the rules at that point. Is that too soon?
I'd have to look at the public hearing and comments, we have to hold another public hearing, is really set by when we receive the FIS back and when the draft rules get published in the rulemaking register. And it's very strict on their timelines, so it has to be filed the Thursday before the rulemaking register is published. So one day can push us back weeks. So it really depends on when the LBA gets us back, and typically their turnaround time is about 12 to 16 days.
Okay, so can we shoot for May 23rd as a public?
We're just talking about whether we should meet in April.
That's the point.
I mean, maybe it could be a shorter meeting. 3 hours is a long meeting, but if we just focus on rules.
Yeah,
So the IP and the rulemaking notice need to be published for a minimum of 21 days before the hearing. So that publication date is really what will drive our hearing date.
so if we meet again in April, we're not gonna have anything back from Gelcar to look at.
Are we not meeting again on draft rules?
Maybe we don't need to.
Yeah, I was gonna say, because we need to,
Okay.
this sounds like right now we're into the issue of the process with Gelcar has, administrative rule process.
Yeah, and there's no way around that process. Yeah, so
So,
we'll just follow the typical rulemaking process.
and then we can follow up again in June. Because hopefully by that time we'll have the public comments, we can hopefully do
Oh,
revisions and
yes.
so forth, get a final one in June.
Yep.
To get the Gelcar at that point,
Yeah,
hopefully.
yeah, hopefully.
Okay.
Because we'll also want to wait for the OLA staff attorney comments, and those can take some time to get back as well.
Okay. All right.
So this can be a long process.
All right, can I have a motion then to accept the draft rules as amended? Motion by.
I'll second.
Okay, second by Senator Sherman. At the roll call, all in favor, say, so President Marsh,
Yes.
President Murphy,
Yes.
Representative, that's it. Tafe,
Yes.
Senator Sherman,
Yep.
Senator Rosenwald,
Yes.
and I vote yes. Thank you. All right,
We want to vote to make the referral to have it. You need a vote for us to actually start the rulemaking process as well?
I don't believe so. I think you guys just need to vote on the rules, which you just did. Yeah.
Good question. All right, so we have got through the rulemaking process. We do have a virtual presentation by Scott Pope. Dr. Pope, he's a pharmacist and an attorney. I recognize. Pace. I want an elevator. Okay, and then we'll go through that for about 30 minutes if you have the time. There's Dr. Pace.
Good morning. How are you?
Good morning. So we do have your presentation. We'll go around the room with introductions. My name is Gary Mertz. I'm a state representative, also chair of the advisory board.
I'm Representative Marsh.
Representative Murphy?
Representative Murphy.
Todd Fahey.
Senator Sherman.
Cindy Rosenwald, Senator.
So to frame this for today, I've been trying to go through different players in the pharmacy supply chain to try to help educate the board about the various players, the roles they play in the pharmacy supply chain, and try to understand in that particular role, how they influence or have an impact on prescription drug pricing and the cost of things. So one of the things in the independent world is the Pharmacy Service Administrative Organization. They're very important to the independent pharmacy. But I wanted someone with the background like Dr. Pace to present to the board more detail about the Pharmacy Service Administrative Organization used by many of the independent pharmacies. So Dr. Pace, do you want to introduce yourself?
Yes, sir. Thank you, Mr. Chairman. My name is Scott Pace, and I'm an independent pharmacy owner. And as you mentioned, I'm a pharmacist and an attorney. And I also do consulting work for a group called the Healthcare Distribution Alliance that represents a group of these pharmacy services administration organizations that you referenced. And I'll mention that my comments today on behalf of PSAOs are representative of a coalition that has been put together. And when I say a coalition, it's a coalition of PSAOs that are owned by larger organizations like pharmaceutical distributors, as well as PSAOs that exist as independent standalone companies. So that's going to be the perspective that I bring today. Now, I know there's a lot of acronyms in the healthcare world, and so I'm going to try to use as few of those as possible during this discussion. And I'm happy to take questions, Mr. Chairman, however you would like that, either during the presentation or at the end, whatever works best for you and your committee.
Do you have a preference which way to go?
No, sir. I'm happy however the committee would like.
It will allow for the questions along the journey of doing your presentation, because sometimes it's helpful for people to ask the question what's fresh in their mind.
Yes, sir. Okay, that sounds great. Well, let me just start off by, again, thank you for allowing me to be here to present this perspective today. I'm going to tell this kind of a story of PSAOs through myself as an independent pharmacy owner. So you may have noticed that my accent is not from New Hampshire. I'm from Arkansas. So I live in Little Rock, Arkansas, and I own a small pharmacy with my wife, who is also a pharmacist in Little Rock. And as we are operating our pharmacy, we got a lot of things that we do every day, right? The most important is that we take care of patients and we fill prescriptions, and we're a part of the healthcare team. But being a small business owner, we also have to do payroll and do our bookkeeping, and we have to contract with health plans and pharmacy benefit managers to make sure that we have access to contracts that allow us to serve patients. And so for all of those functions that I mentioned, there's an opportunity to carve out the back office function. So, I hire a CPA, for example, to help me with my payroll. I hire a bookkeeper to help me do my back end books. And I hire a pharmacy services administration organization, or a PSAO, to help manage those contract relationships between health plans and PBMs. So from a day-to-day perspective, they are my back office as it pertains to that one small part of my business. Now, I'll say this, I could do it myself if I wanted to. It is just simply more efficient for me to pay what is approximately $200 a month to the PSAO to manage those relationships on my behalf than it would be for me to manage all the contracts and addendums that come in on a regular basis for my business. So that's just a very high level view of how PSAOs work in the independent pharmacy world. And if you look at that second slide, I think this gives you a very good picture. If you look at that bar graph of where PSAOs sit in the healthcare world in the pharmacy space, you'll notice on that pharmacy reimbursement line, they sit as the only entity besides the pharmacy and the PBM and health plan in between those. And that's because that's what they do. They help to evaluate and manage those contracts that come from the PBMs to the pharmacies. And they have, special teams that evaluate those, look at the payment terms that the PBMs offer, and make a decision as to whether or not it makes sense for your pharmacy to participate or not participate in that network. They also, whenever, as a pharmacy owner, if I have problems with that PBM, I call them to help manage that relationship. So, for example, sometimes a PBM requires me to re-credential on an annual basis, and my PSAO helps me to go through all of the hoops that they put in place to re-credential. They help to facilitate central payment, which means that when a PBM pays me, the PSAOs actually help to aggregate those payments and send them out to me so that I can get them faster than if I was waiting on a paper check from the PBM. And I think one of the most important things they do for me, besides help with gaining access to contracts, is they help with claims reconciliation. So that means if a PBM says they're going to pay me $10, when the money gets to me, the PSAO helps to pass along what's called an 835 form, which is an electronic reconciliation form, to make sure that the $10 that the PBM said they're going to pay to me actually gets to me. So they're really, that reconciliation function is really critical. It's think of it kind of like balancing your checkbook, right? You want to make sure that somebody didn't accidentally run a $1,500 check when you wrote a $150 check. It's those reconciliations on the back end that are very important to make sure that you're not shorted any money. And then they also help with any audit support that we have. Pharmacies get audited from PBMs on a fairly regular basis, and sometimes those audits are not viewed as fair by the pharmacy. So the PSAOs help to provide support during that audit process. And as I mentioned at the front end, I pay about $200 a month for that PSAO service. That's the totality of what a PSAO charges me. They don't make any money from the health plans. They don't make any money off of paying you less than what the PBM paid you. They charge you a flat fee, and that is the totality of what they pay you, or excuse me, of what I pay them. So who are these PSAOs? On the next slide, about a decade ago, there were over 20 of them that were floating around in the independent pharmacy space to help with these functions that I have mentioned. Today, there's less than 10, and there's really about 6 that operate most of the market.
Dr. Case?
Yes, sir.
Do you want Nancy to display the slides as you're talking?
Yes, ma'am, if that would be possible. I have them up on my screen, but was not able to figure out how to get them projected to your screen.
We can do a screen share if you want.
Yeah, whatever you'd prefer. I think I see how to. Let's see if I can figure out how to screen share here.
Because there's people in the room that don't have a copy of the slide deck, maybe they didn't bring them with them.
Yes, sir. Let me see if I can figure that one out here real quick.
Okay.
There are copies in all these, right?
There we go.
Let's see. Can you see that now?
Yes, we can.
Okay, great. Okay, perfect. So back to who are the PSAOs? They are, there are about 6 of them that really operate in today's marketplace that you probably see in New Hampshire. There's one called Health Mart Atlas. That one is owned by McKesson Pharmaceutical Distributors. There's one called Elevate that's owned by Amerisource Bergen, which is also a distributor. There's one called LeaderNet owned by Cardinal Health, which is a distributor. And those are the three that are affiliated with healthcare distributors. The other three aren't affiliated with healthcare distributors at all. They're standalone entities. One called Epic Pharmacy Network. They're out of Maryland and they're a standalone PSAO. One called Pharmacy First, which is also a standalone PSAO. And then one called Align RX, which used to be called, it merged recently. It was called Arete and Pharmacy Providers of Oklahoma. And they changed their name to Align about a year ago. So those are the 6 big ones that really operate in the country and in the Northeast in particular. And they have a conglomeration of pharmacies, as you can see on that slide, between as few as 1,700 pharmacies and as many as 6,800 pharmacies in their network. And that's, you would think from a scale perspective that would give leverage. The truth is that doesn't necessarily create leverage. It just simply creates scale for the pharmacies to have the ability of one person who's evaluating those agreements on 6,800 pharmacy side. But there's no true negotiation leverage there because of federal antitrust laws, which prohibit marketplace competitors, unless you're a sports team or a railroad or a union, from being able to come together and truly collectively say no to contracts. All right, let's see here. I'm trying to make sure does your screen say community pharmacies and/or chain pharmacies at the top, Mr. Chairman?
No, it says who are PSAOs.
Okay, now does it say scope? Okay, thank you, sir. Okay, thanks. So let's talk about the scope of what the PSAOs do and what they don't do now. I kind of told you those back office functions at the beginning of the presentations about how they help me as an owner to manage my relationships with pharmacy benefit managers and health insurers, helping me understand what my rights and responsibilities are in those health plans, the compliance piece, aggregating claims, and the central payment. Those are those back office functions that they do. What PSAOs don't do, and I think these are really important because this gets purposely conflated in some of the discussions. PSAOs don't have anything to do with dictating reimbursement rates. Reimbursement rates are established by pharmacy benefit managers and health plans. They are the originators of those contracts, and they are the ones that determine and set those rates. PSAOs do not set maximum allowable costs. Now, that MAC term, maximum allowable cost, is a term that you may have heard as it pertains to how generic drugs are often reimbursed. Those are also proprietary numbers that are set by pharmacy benefit managers. PSAOs don't set a plan formulary. Those are done by health plans and pharmacy benefit managers. As I mentioned earlier, they don't keep any of the reimbursement fees. Those are all passed 100% to the pharmacies. And despite some people saying that PSAOs just accept all contract terms, they don't. They in fact turn away contracts when they are not feasible terms for a pharmacy to meet. But again, because of that anti-collective bargaining that I mentioned earlier, if a PSAO says no, it doesn't necessarily mean that the PBM won't turn around and go right back to each individual pharmacy to try to get them to contract independently. And in fact, that's what happens very frequently, because they don't have that legal ability to say no and make it stick like you would in a union negotiation or a baseball negotiation, as we've just recently seen. That federal law doesn't allow that. And then finally, the copays to a patient, the network design, all of those structures of the health plan and the pharmacy benefit, PSAOs also don't have anything to do with those functions. Those are also health plan and PBM functions. And I say all that just to say, because this is kind of a new and uncharted world for people to start talking about, the back office functions of a pharmacy, it's real easy to conflate what a PBM does with what a PSAO does. They are two very distinct entities that don't cross over into the same functions. And I just wanted to make sure I reiterated that. So from what states are seeing and doing with PSAOs, I'll tell you a little bit about what is being said and what the reality is. There's been a national campaign by the Pharmacy Benefit Manager Trade Association indicating that PSAOs are these great equalizers in their negotiations with between pharmacies and PBMs. And unfortunately, that's just not accurate. They are trying to make the leap that a large company like a McKesson or an Amerisource that are distributors can bring the scale of their distribution business to negotiate on a pharmacy reimbursement side of the world. And it just simply doesn't, it just isn't true. If that were true, you would see different reimbursement rates between the big PSAOs connected with the wholesalers and independent contracts that pharmacies get, or even the non-wholesaler affiliated PSAOs. The material difference in those contracts are just not there because the PBMs contain all of that marketplace leverage. The big three PBMs have 85% of the lives in America that they, I'll use finger quotes and say negotiate for. But it's kind of like negotiating with your electric company. You either take the rates that they give you and you have electricity, or you don't and you sit in the dark. And that's really what these negotiations are like. There has been an inaccurate perception that the PSAOs impact the cost of pharmaceutical drugs. They don't. Those rates, as I mentioned, are set by the pharmacy benefit managers. And there have been some states that have proposed legislations dealing with PSAOs. Maryland did that a couple of years ago and are in the process of actually changing some of the legislation. It required registration of PSAOs and disclosure of the contracts that the PSAOs enter into with the PBMs. And that's great from a transparency point of view. The PSAOs don't have any problems with the take it or leave it contracts that the PBMs put forward being disclosed to insurance departments, but it needs to be done in a responsible way so that the burden of disclosing the contracts is on the entity who writes the contracts, which is the PBMs. But again, so the conflating of those PBM and PSAO issues in other states has been problematic because some states have tried to put prohibitions on PSAOs that they don't do. So for example, saying that PSAOs can't do spread pricing. Well, again, spread pricing isn't a byproduct of a PSAO. It's a byproduct of a pharmacy benefit manager and their relationship with a health plan. So just to reiterate that, they aren't insurers. They don't do the same function as an insurance company, and they aren't PBMs. And they don't do the same function as a PBM. I will tell you that from my perspective, as an independent owner, and I'll go into this next slide in just a second. As an independent owner, man, I wish my PSAO had more leverage than it did because it feels like we're fighting upstream sometimes with pharmacy benefit managers, but it's just the reality of their scale in the marketplace that even the big chains, even the ones that can collectively negotiate together, like the Walgreens and the Walmarts of the world, have had very public spats with Express Scripts and CVS Caremark in recent years. I mean, even Walgreens stopped taking TRICARE prescriptions that are administered by Express Scripts for quite some time because they couldn't come together on terms, because even the biggest pharmacy chain in the world couldn't fairly negotiate with these folks. And so I wish they had more leverage than they did. The reality is the market just doesn't have that right now. Let's see here. I've already mentioned that PSAOs and PBMs aren't the same and shouldn't be treated as such. But just remember that they do have a role, and that role is to help me with my back office functions, to take the burden of me as an everyday pharmacy owner who's trying to take care of patients, to have somebody who can sit and evaluate and help me in those interactions with the pharmacy benefit managers. And I put my email address on this slide. I'm more than happy to help discuss any questions or proposed legislation that you guys may be considering related to PSAO. So I can give you both the pharmacy perspective as well as PSAO perspective. So just to summarize, these are administrative organizations that charge a flat, transparent fee. I know how much it is on a monthly basis, and I pay it. And if I choose to not do it anymore, I can contract completely by myself. I also can choose to switch PSAOs if I don't like one and want to go to another. All those are completely permissible activities. They execute those contracts and evaluate those contracts, but again, as I mentioned, they don't really have any true negotiation power on those contracts with the PBMs. And I'll also mention sometimes PSAOs are accused of doing things that they don't do, such as dealing with manufacturer rebates, determining medication costs, or even selling medicines. The PSAO function of these businesses don't do any of that. They sit exclusively between the pharmacy and the PBM on that slide number 2 in that one area of the bar chart that deals exclusively with the pharmacy and the PBM and that relationship. So their administrative support and expertise is very important to me to help serve my patients. And that's the role that they really play. So with that, I'm happy to, Mr. Chairman, answer any questions. This is my contact information. Like I said, that's my cell phone as well as my email address. And I'm happy to entertain any questions now or after this meeting, but I hope that's helpful to learn a little bit on what PSAOs do and don't do and how they help me as an independent pharmacy owner.
Thank you for that. Is there any questions from the board?
Yeah, thanks for that presentation. I'm just trying to be super clear. If you are, well, let me ask this because I'm a little fuzzy. Are you negotiating a contract with the PBM, or is the pharmacy negotiating a contract?
Say that question one more time. I'm sorry, I didn't quite understand the question.
So Scott, are you negotiating the contract with the PBM, or is the pharmacy negotiating the contract, and then you're just managing the negotiated contract?
So the PSAO is the entity that communicates with the PBM on the contract. So they are the ones that receive it on behalf of their pharmacy members. Do they have discussions about what they like and don't like in the contract? Sure. Is it a true tit for tat negotiation? Not really. So I mean, these are essentially adhesive contracts, take it or leave it contracts that are offered, whether it's to the PSAO or to the individual pharmacy. But the PSAO is the one who ultimately executes it for me, if that's the question that you're asking.
Yeah, so these are take it or leave it contracts, but suppose you're managing, as a PSAO, you're managing the contracts for a large number of pharmacies in a given distribution. Wouldn't you be able to know and possibly recognize that a contract that's being offered is really not on good terms? And so wouldn't you, just by the volume of service you're providing, be able to understand how whether that's a good or bad contract and be able to reject it? Or is that just, there's no role for that in the PSAO world?
Well, no, I think it's a great question. So the truth is the PSAOs do reject contracts. They do that evaluation and they do reject some. As I mentioned earlier, however, if a PSAO rejects it, they aren't allowed to reject it and have that rejection be a quote unquote boycott of a network. The PBM ends up going to the individual pharmacies and offering them the same bad contract to try to get them to individually accept the contract to build that network.
So what I'm getting at is and I don't mean this in an accusatory, it's just so I can understand. Wouldn't PSAOs therefore have some influence or capacity to drive cost because they are working with the contracts for reimbursement of pharmacies?
Well, I think that question is appropriate if there were the ability to upward negotiate rates, but that's all predicated on a real negotiation that isn't just really seen in this industry because of the disproportionate leverage that exists. If that leverage, I'm sorry, I was just going to say if that leverage was truly more balanced, then the answer could be yes, but that's just not what exists in today's marketplace.
So hopefully my final question would be, if a PSAO rejects a contract and it's not involved with pricing, why would a PSAO reject a contract?
Well, because the PSAO evaluates the contracts, right? So the payment terms that are offered by the PBM, if the PSAO looks at that and determines that those rates aren't feasible for a pharmacy to make money or even to break even, that's when they would reject a contract.
Thank you.
Thank you.
Hi there, Scott. What leverage does the PSAO have to compel better terms than kind of a contract of adhesion that you're describing, right? What leverage ultimately do you have?
Really, it's administrative efficiency exclusively is the leverage that exists, which is, I think that's, you just nailed the problem right at the outset. If there was more leverage, then there would be an opportunity for true, meaningful back and forth discussions. But because the leverage doesn't exist, its evaluation and execution is really their administrative efficiency role.
Thank you.
Yes, sir.
Jim Murphy, my question is, how long have these organizations been around, and what was the imbalance are you describing, the impetus behind their creation?
Well, the organizations have been around for, golly, 25, 30 plus years. They've been around for a while. I think the impetus behind their creation was, again, the administrative efficiencies for again, me as a pharmacy owner. I mean, I'm a lawyer, as I mentioned, as well as a pharmacist. And so I've got the sophistication and ability to be able to read and evaluate these contracts. 99.99% of pharmacists don't have that type of legal training. And so when you're facing 40, 50, 60 page contracts and addendums and new networks and terms that you just don't even understand, it made sense years ago for somebody to be more versed in that, and they became that administrative efficiency arm to help people take a subject matter expertise off their plate, and that's what I believe was their true impetus.
So it sounds as though it'd be like the conifers of the world that help hospitals with backroom functions, to take that, and centralize it elsewhere. So my sense is when I'm listening to you is that there may be some, not antagonism, but there is some friction sometimes between PSAOs and the PBMs. Is that not true, or is that true?
No, I think that is true. I think, the PBMs benefit from the PSAOs because instead of the large PSAOs, for example, that have 6,000 pharmacies, they can execute a single contract with one PSAO instead of 6,000 individual contracts, right? So there's administrative efficiency there. Just like from a pharmacy's perspective, they can enter into an agreement. There's an efficiency with them having a PSAO manage all their contracts for them instead of the individual pharmacy. So there's kind of this mutual administrative efficiency, but the PSAO always wants to do what's better for the pharmacy first and foremost. There's antagonism there because the PBM says no, right? And that frustrates the pharmacy side of the world because the pharmacies, people like me, wish that their PSAO could go in and butt heads and come out on the positive side of that. That's just not where the leverage lies right now. So they are an administrative necessity for the pharmacy but I think that the pharmacies wish they could do more than they are able to do.
My last question is that the genesis of our board is really to understand the costs and help somewhat control the costs in medicine and in pharmaceuticals in particular. We have been shown several presentations, and as you know, Chairman Merchant would tell you, it's a very complex world in the pharmaceutical world, even for us who have been in medicine for a long time. How much measurably is this another layer of cost that is passed on to patients and prescriptions, or, you know, how measurable is the cost added here relative to the benefit gained by you guys?
Yeah, it's a great question. So as I mentioned, I spend about $200 a month out of my business on my PSAO function. So annualize that, I spend $2,400 a year, which to me is the totality of the cost, and that replaces my personal time or a staff person that I would have had to hire to do that functions for my business. So that's really the only true cost in the system. I consider it kind of an employee or a contractor type expense. There isn't anything that is directly to the patient in the cost of it at all. It is simply it's like me having an extra clerk, so to speak, on my payroll.
Thanks.
It's a great question. I appreciate that.
Well, Dr. Pace, thank you for presenting to us today and so forth, and help us understand the Pharmacy Service Administrative Organization and the framework in which you're coming from. My takeaway from this is that there's very little the PSAO is doing to increase the cost. It sounds like a lot of it's being driven by the PBM world, which is what you're negotiating with. But as far as your ability, not you personally, but the organizations to have upward pressure on reimbursement, which would add to the cost, that's not what I'm hearing.
Yes, sir. That's correct. Mr. Chairman, if I could, just point a quick privilege before we conclude. I had the opportunity to be at your state capitol a few years ago on my family vacation, and we enjoyed getting to tour that, seeing your Hall of Flags, and getting a picture out in front of the Franklin Pierce statue. We live on Pierce Street in Arkansas, which is named after the former president, former speaker of the New Hampshire House. So it's nice to get to see you all virtually, and it was nice to visit in person a few years ago.
I'm glad to hear you enjoyed your visit and gave a lot to help our economy. Thank you.
Thank you all.
Okay.
Thank you.
All right. Sherry, mind if I hold this up? Here's a couple of things. I've lost the other one. So I'm going to skip over the meeting with the AG's office. I don't think we have to have that at this point in time. Therefore, we're not going to resume, and I'll open it up for public comments. Sure.
Thank you, Mr. Chair. Just a question that came up, I think, in my mind, in response to a question from Senator Sherman, I think a question from Representative Murphy. Does this board intend to have a similar presentation from the wholesaler distributor community?
Yes, I also was going to reach out to Heidi to find out the insurance industry would like to have a presentation as well, because each one of them has got a role in this process.
Thank you.
So is there any other public comment that people want to make at this point? No. We have the dates for the future meetings, which is May 23rd and June 20th. If that's the case, I guess we could make a motion to adjourn. I'll second. How's that? Oh, I got President Murphy's on the call. We still got a quorum. Okay, well, I don't think technically. So you want to make a motion to adjourn? Well, I'll make a, what do you call it? A undebatable motion to adjourn by the chair.
Second.
So. Yeah, thank you. Question. Yeah.
Sorry, I was muted. I did say yes, but.
You did say yes? Okay.
We read your
We
lips.
don't know if you're going to be here forever.
I'll see you Thursday.
All right, take care. Thanks.
See you later.
Okay.
Thanks, Mark. Yes.